Very good morning, everyone. Welcome back. I am Dr. Rahul Agarwal. Today, I will be discussing a very important topic, and it is not very commonly used, very commonly touched by the faculties. So, I will be discussing today the antiseptics and disinfectants. This is the very important topic because it has recently been added also in the curriculum. So, we'll go through antiseptics and disinfectants. This is the two terms have slight differences, but that we will see later on. And these are the some common disinfectants and antiseptics. These in day-to-day life you have all seen the bleach, formaldehyde, butyldehyde. You have all seen through these antiseptics. These are the disinfectant, and some common antiseptics, povidone, iodine. We know about the povidone, iodine, and we have seen in the hospital settings. The hand sanitizer, what we have used very commonly during the COVID time. So, chlorxidinol, chlorhexidine, these are all antiseptics and disinfectants. Some examples of antiseptic and disinfectant. We will see some common antiseptic disinfectant also. So, I will be covering this topic under the broad heading of definition first. What is the difference between antiseptic and disinfectant? And how it is different from antimicrobials, because there is a term antimicrobial, antibiotic. We have learned that what is the difference between that and this. Then classification, how can we classify the antiseptics and disinfectants? Basically these antiseptics and disinfectants are chemicals, so we will classify according to the chemical, but there is one more classification according to the mechanism of action. So, then we will go through the some of the individual agents like phenol, Dettol, Savlon. So, we will see what is there in Savlon, what is there in Dettol. We will all see. Then the summary, and then some the MCQs for you, so that you can go through the you can go through the lecture. So, coming to this definition. First of all, the definition. What is the antimicrobial? We have seen the antimicrobials. We have given the we all used to give antimicrobial through either injection or oral, basically. So, antimicrobials, these go to the systemic circulation. So, antimicrobials are basically antibiotics. What we say are for the systemic infection, and that is if we are giving systemically. If we are if it is going into the systemic circulation, it should have the high margin of safety. Otherwise, if the dose will increase, the adverse effect will start increasing. So, antimicrobials is mainly used for systemic infection, and it is having the high margin of safety also. Now, coming to the antiseptic, which is our today's topic. Antiseptics are the germicide for the inanimate living surfaces. So, to mnemonic, I am going to tell you how to remember between the antiseptics and disinfectants. Antiseptic is AN, starting with the AN, and antiseptics are useful for the animate matlab animate is also AN. So, antiseptics, those which are used for the living surfaces, like we are using for ourselves, we are using antiseptics for our body, for our mucous membrane. So, this is the antiseptic, not the disinfectant. So, antiseptics are used for the animate means the living surfaces. These are having the low margin of safety. That is why we are not using systemically, we are applying the topically only. This antiseptic falls under the control of drug controller agency. Disinfectants falls under different control. The antiseptic fall under control of drug control agency. Disinfectants, whereas the disinfectants is having, if you see clearly, disinfectant is having the IN, and disinfectants are used for the inanimate object. Inanimate means it is for the non-living surfaces. Like we are using some disinfectant to clear the instruments what the clinician used if on one patient, so that it cannot infect the other patient. So, we are using to clean the instruments. So, for that purpose it is called the disinfectant. It is not the antiseptics. So, disinfectants used for the non-living surfaces, antiseptics used for the animate, disinfectant used for the inanimate, and both will having the low margin of safety. That is why the topically it is used, not the systemically. This falls under the control of Environmental Protection Agency. Disinfectant falls under the control of Environmental Protection Agency, EPA, and this antiseptic falls under the drug control agency. Okay, this is used for the non-living surface, this is used for the living surface. AN for animate, IN for inanimate. So please remember this slight differences. So now come to the definition part. What is antiseptics? So if you have gone through, if you have heard my lecture, the previous slide carefully, then antiseptics are the chemical substances that eliminate the microorganism from living tissue. Antiseptics are for the animate, for the living tissue like skin and mucous membrane. Whereas there is a slight difference between the disinfectant and sterilization. You can clear from here only. Disinfectants we have discussed for the IN, I is for inanimate. Disinfectants are for the non-living microorganism, for the inanimate objects, but not the spores. Now here is the difference between the disinfectant and sterilization. Both are for the non-living, but the difference is sterilization as for sterilization as for a spore. Sterilization, we use the term sterilization when it kills the spores also. Disinfectant do not kill the spore, sterilization kill the spores also. Okay. So now coming to the next thing, he is the father of antiseptic surgery, Joseph Lister. Why he is known the father of antiseptic surgery? Because he was the first who used the first antiseptic, carbolic acid, which was used to prevent the sepsis during the surgical procedure. Nowadays many other antiseptic disinfectants are there, but the first antiseptic, carbolic acid, was used to prevent the sepsis, so that post-operative sepsis do not occur during the surgical procedures. Okay. Now coming to the classification part. I told you the classification basically is done according to the chemical agent. So here also I am having the mnemonic to remember the various classification for the chemical agent, that is the pharma god. Pharma god. P, where P is for phenol derivatives, and I think you have heard about the Dettol and the Savlon. So this falls under the phenol derivative. Dettol is the chlorxylenol and Savlon is the chlorhexidine. How to remember between the which one is the this chlorxylenol is having the ending with the letter OL, and Dettol is also ending with the letter OL. So you can remember this with the Dettol is having the chlorxylenol and Savlon is having the chlorhexidine. So one is the phenol, one is the halogens. Halogens we have the iodine and chlorine, iodophore and chlorophore, the halogens. A is for alcohol. Alcohol, we have used the alcohol, lot of alcohol we have used during the COVID time. Alcohol swab, alcohol, ethanol, isopropanol. These are the two alcohols which are used in the antiseptic disinfectants. So I think you have heard about the alcohol aldehyde acid, this chemical reaction. There is another A, what you are seeing here is for the aldehyde, and another A is for the acid. Now after alcohol A, there is a R. R is surface agent. Surface agent, we have the cetrimide and benzalkonium chloride. Then metallic salt, whereas mercury, silver, zinc, calamine. This silver, where you have heard silver? Yes, silver is used in the burn dressing, silver sulfadiazine part. So metallic salt, mercury, silver, zinc, calamine, these are the metallic salt. Aldehyde, formaldehyde, glutaraldehyde. I think you have heard about the formaldehyde. Yes, in your first year anatomy department, the cadavers are placed in the formaldehyde to prevent to protect those cadavers. Then with the acid is the acetic acid and the boric acid. Okay. Then G, coming to the G for gases, ethylene oxide gas, and O is for oxidizing agent, potassium permanganate, hydrogen peroxide, and D for dyes, gentian, volet, acrylamide. So this you can remember with the pharma god. P is for phenol derivative, H for halogen, A for alcohol, surface agent, metallic salt, aldehyde, acid, gases, oxidizing agent, and dyes. So these are the various antiseptics and disinfectants which are used. So this is classification according to the chemical agent. One more classification I am having according to the mechanism of action. But there is a thing like aldehyde or alcohol or any other antiseptic disinfectant can act on multiple mechanism. Like DNA, you see the aldehyde is acting on the DNA also. It is disrupting the DNA also. Aldehyde is disrupting this cytosolic also. Aldehyde is working here also in cell wall, and Aldehyde is working here also in the sulfhydryl metabolism. So one agent can act on multiple ways. So this is the here it is not specific that one agent will act on single thing like DNA or cytosol. Okay. So this is the classification according to the mechanism of action. This is not it's very tough to remember the everything, but it is important to remember this classification according to the chemical agents. Okay. Coming to the individual agent, some individual agent we will discuss, like the phenol derivatives. Phenol derivatives, you have all heard or you have all used the Dettol, but you have never gone through that what is there in the Dettol. Dettol is having the chlorxylenol component. Dettol is having the chlorxylenol. It is a phenol derivative, not the phenol. Phenol we don't use because of its corrosive nature, but its derivative we can use, and chlorxylenol, which is non-corrosive, non-irritant hai, but it is a phenol derivative and this is less toxic, that we can use. Where it is used, and we all know about uses, we have used for the surgical disinfection, for antiseptic cream and soap. चोट लगती है तो we use the Dettol, and as mouth washes chlorxylenol, but 1% concentration is changed. So this was the regarding the Dettol, which is the chlorxylenol. One more phenol derivative we will see, the chlorhexidine. Phenol, Dettol and Savlon, these are very commonly used in your household also. So Savlon, but what is there in the Savlon? This you should know what is there in the Savlon. Savlon is having the chlorhexidine and cetrimide solution. So chlorhexidine is present in Savlon, powerful antiseptic against sensitive bacteria, less active against gram-negative and spores. So chlorhexidine, if you ingest by mistake, then also it will not get absorbed into your intestine, from your intestine or stomach. So it will have the very low systemic toxicity. Skin irritation is also very low. That is why we can apply on our skin. It is various uses. It can be used for the hand wash and as perioperative antiseptic for skin, as mouthwash, and this I think you have used this for the dentist have prescribed you chlorhexidine mouthwash. First aid and disinfection of the floor and mattress. We use the Savlon also to clean our floors. Now second, another one is the povidone iodine. This we have seen in the hospital settings, various povidone iodine dressing is done with the povidone iodine, and before operation the skin surfaces is made antiseptic with this povidone iodine only, because if the surgeon performs any procedure that can land the external bacteria into inside, so that's why the dressing pre-operative preparation done with the povidone iodine. So similar to iodine, but it is non-irritating. Iodine is non-irritating. So we are using the povidone iodine, which is non-irritating, non-toxic, does not stain the skin or cloth and does not cause burn. How povidone iodine is used? Where it is used? It is used in boils, burns and tinea infection. To disinfect the endoscope. So we are for our instrument also to disinfect it, we use the povidone iodine, and lower concentration can be used for the mouthwash, but in the lower concentration only. Okay. Then to form chlorine and chlorophores. Chlorine, I think you have heard. Now chlorine also, where in the swimming pool, to disinfect the water, generally the chlorine is used. The universal disinfectant, as it can kill viruses and prions. When it react with the water, it converted into HOCl and used for water purification and disinfection. So very commonly chlorine is used for to disinfect the water in the swimming pool or in the anywhere else to disinfect the water. Chlorophores, this sodium hypochlorite solution is very commonly used in the dentistry. Sodium hypochlorite used for the root canal treatment in the dentistry. The bleaching powder you have heard of, this is the chlorophore only. Okay. Now alcohol swab, you have all seen alcohol swab we used for the to prepare the skin, to make the skin antiseptic when we give IV injection or IM injection. Alcohol swab is very commonly used, but what you have to remember, which alcohol, ethanol and isopropanol. And another important thing, what concentration. Alcohol at 100% is not an antiseptic. This is very important. 100% alcohol is not antiseptic. Antiseptic concentration is this only, 60 to 90, not below this, not above this, not above 90, not below 60. So alcohol rapidly active against gram positive and gram negative irritant, so cannot be used in open wound. We don't use in open wound alcohol. It अगर कटा होगा उस पर alcohol use करेंगे तो it will irritate the skin. So or not used in open wound, mucous membrane and delicate skin. We only use alcohol in the intact skin. You have seen that. Uses skin antiseptic before IM and IV injection and disinfected the inanimate object except those having the leather covering, dental chain. Okay. 3 metallic salts: mercury, lead, silver. Mercury, silver, zinc. Mercury. You heard about the mercury poisoning. Nowadays we don't use the mercury, but there is one thing where mercury is used. Not the mercury, the mercury derivative thiomersal. Thiomersal is used to preserve the vaccine. The vaccines are preserved with this thiomersal preservative in the concentration of 0.01 to 0.004%. Silver compound, silver sulfadiazine you have heard of very much. Silver sulfadiazine for the burn dressing. Burn के ऊपर जो एक cream लगाते हैं, that is having the silver compound. Silver sulfadiazine. Sulfadiazine is an antimicrobial. It's a sulfonamide, and silver plus sulfadiazine. Sulfadiazine will act as an antibacterial. What is the silver doing here? Silver is attracting the water, making the burn area little bit moist. Okay, so silver with sulfadiazine is used for the burn dressing, and silver nitrite eye drop is also there for the gonococcal ophthalmitis in newborn. Zinc compound, calamine, many of you have used the calamine also. Calamine lotion is there. Okay, that is having the zinc compound. Okay. Aldehyde, this you have heard. Formaldehyde. Formaldehyde, where you have seen? In the first year anatomy. The cadavers are preserved within the formaldehyde. You can see the different organs. These are preserved in the formaldehyde. Formalin 4%. The pungent gas, like when you enter into the anatomy lab, you have to, it's very pungent, it's very irritating. So pungent gas and irritant, so that so not used as antiseptic, mainly used as disinfectant. So 10% solution used to disinfect the instruments to disinfect again. And fumigation of premises means when you have to fumigate the ward or fumigate the OT, then you close that ward and formaldehyde spray is done. Then after some time, after 12 hours, that is opened. So it will kill all the microorganism, all the bacteria. 4% solution is also used for preserving the dead tissue, which you have seen in your anatomy lab also. Glutaldehyde is much better than formaldehyde. Why? Formaldehyde is having the very irritant smell, very pungent gas, but the glutaldehyde is not irritant, not so irritant. So when you have to use among the two, to use the glutaldehyde, okay, because it will not irritate your nose. 2% solution used to disinfect surgical instrument, glassware and endoscope. So mainly glutaldehyde 2% solution that is used for the cleaning of your instrument part. Okay, not formaldehyde. If you are using the formaldehyde, again it is a pungent gas, you will not be able to clean your instrument. Glutaldehyde, it's not a pungent gas, you will able to clean your instrument also. Now coming to some MCQs. So now at the last we will discuss some of the MCQs part. So you have to answer that MCQs. A 30-year-old man with abrasion in the arm and the leg uses Savlon antiseptic liquid. What is there in the Savlon? We have discussed in the Dettol there was a chlorhexidine. In the Savlon there is a chlorhexidine along with cetrimide. Yeah. Okay. So Savlon is having the chlorhexidine plus the cetrimide. Another MCQ. One more. Ideal agent of choice for non-corrosive metallic surgical instrument sterilization. If you have to sterilize the instrument, the endoscope and everything, so what is the ideal agent? Among formaldehyde and glutaldehyde, which was the best? The glutaldehyde was the good. Formaldehyde was having the pungent smell. So the option can be this or this. And we have seen in the previous slide, glutaldehyde slide, the 2% glutaldehyde was there. Okay. Thank you for the attention.